Hello, my name is Clark Simpson, and I'm President and CEO of the Clark Group Associates. I'm privileged to be with you today to talk to you about Billing 101, what you need to know to be able to get you started. Before we get started with the presentation, I do have some disclosures for you. As I did say, I am President of the Clark Group Associates, and the Clark Group Associates is a consulting company working in the sports medicine, athletic training business space. We do work with national associations, one of which has been the National Athletic Trainers Association. We've worked with multiple state associations on business and business strategy issues, as well as many collegiate university sports medicine programs. My background, I am an athletic trainer and have worked on the business side of athletic training for the majority of my career. I have started athletic training outreach programs and rehab programs within hospital systems. I've been a practice owner myself. I was vice president of a health system and ran all the rehabilitation services for 4 hospitals. And I was also chief operating officer of a for-profit rehab company that was owned by 4 hospitals, and we handled rehab services for multiple hospitals and standalone rehab practices. Today I am president of Clark Group, and really enjoy working with many of you in the sports medicine space, and very excited about the opportunities that we do have. Billing 101, what are the basic aspects that we need to be working on as athletic trainers in considering billing for third-party reimbursement? This is an entry-level presentation. So if you're in this presentation and you have been billing and doing that sort of thing, been exposed to it at all, I would hope that a lot of this information would be things that you've already done. This presentation really is meant for that athletic trainer or that administrator or group that are looking at what are the things that need to happen and need to be considered for athletic training for athletic trainers when we're looking at billing third-party payors. As part of this presentation, as you can see here, we're going to really look at that foundational information and knowledge that we need to just get started. I want to talk to you somewhat about the benefits of third-party billing, but I also want to talk to you about some of the drawbacks of third-party billing. There are different types of third-party payors, and I think it's important for us to know that one size does not fit all in the types of third-party payors, so we need to understand that. We'll talk a little bit about contracting and credentialing. That would be relating to the in-network and out-of-network type of work that we would be talking about with insurance companies. I want to talk to you a little bit about CAQH. We'll explain what CAQH is, why it's important in this, and really does relate to the whole contracting credentialing piece. NPI number, I'm hoping that if there are athletic trainers on this, that this is old hat and you know all there is to know about NPI with all the work that we've done in this, but we'll touch on that. We'll talk about billing codes, both diagnostic codes as well as procedural or service codes. And then finally, we'll end up our presentation in talking about payment denials. No matter what specialty healthcare group you are within healthcare, physician, PT, OT, athletic trainer, health system, whatever the case may be, everyone deals with payment denials. So we'll talk a little bit about that. So let's get started in going with this. First of all, I think that one of the absolute first things that we have to understand and consider that as an athletic trainer, you need to be at the level of regulation that your state has that you're practicing in. So the majority of states, that's going to be licensure, but there are some states it's certification or registration. We do have one state in California that, as of this recording, is not regulated, but we're hoping that it will be soon. So you need to be, at that level of regulation within your state. Do you have your NPI, or National Provider Identifier? And we'll talk more about the specifics of that later. You need to know and understand your State Practice Act. So not only are you regulated within your state and you are licensed, but do you understand what that license, that scope of practice states? It's amazing to me the conversations that I've had with athletic trainers across the country as I've done consulting, and when I've asked about their State Practice Act before I've read it or that sort of thing, that they cannot really quote to me what they're able to do. So we really need to understand that. Does it spell out you can or you can't do certain things? And it's not just about third-party billing, but it can do that. And for your information, I'm aware of, again, at the time of this presentation, there are 2 states within our country that actually within the Practice Acts state that the athletic trainer cannot bill a third party for the services they provide. So in Kentucky and South Dakota, currently that's what they state. Of course, both states are looking at this and really wanting to get that language changed. Are you aware of what kind of activities from a third-party billing and reimbursement standpoint is going on in your state? So, and how do you find out about that? The research, with that would be contact your state athletic training association. You may reach directly out to the president. Most state associations have a very good website which will list their officers or their committees. If the state that you're in has a COPA committee or a Council on Practice Advancement committee, that is where this information should come. So you ought to reach out to the chair of that committee to do that. If there is not a COPA committee, then Governmental Affairs committee very well may be aware of that. And if neither one of those committees are active in your particular state, certainly reach out to your state president and see if they can direct you. You're looking for, is anyone in the state in which you're in, is there any activities going on? Are people billing? And you want to find out whatever information that you can about that. How are they doing it? How successful are they? What issues have they had? And ask for references to be able to talk with them. And then, lastly on this particular slide, make sure that you've got referrals for athletic training services. So make sure that you have a referral or a treatment order for yourself as an athletic trainer. And that could be for an athletic trainer, athletic training, for sports medicine, or physical medicine and rehab. So another way of saying this is that we as athletic trainers cannot provide treatment under the order or our prescription for physical therapy or occupational therapy unless we're dual credentialed and happen to be licensed in those areas. So we need a referral or treatment order for these. I would also add to that while we as athletic trainers can see our clients, our student athletes, without having specific orders for treatment. And we do that, that's a very common practice, and within our scope of practices in our states. We're talking about third-party reimbursement and working with insurance companies now, so I consider that taking a step up, or maybe even two, on the requirements that are needed by that insurance company to be recognized and be paid. So certainly myself personally, our company, Clark Group Associates, when we consult with any group, we make the recommendation that that the athletic trainer have a prescription for treatment of the rehabilitation of that client, student athlete, or the client they're working. And again, that may be a paper prescription, or in these days it very well may be more of an electronic order in the EMR. So we really need to look at that. What else do we need to look at? Well, professional liability insurance. Anything that we're doing, within the healthcare field. Unfortunately, we live in a very litigious environment, and so you really need to be covered. You need to check in, if you are working for an employer, you very well may have professional liability insurance that covers you for doing this, but you need to check into that coverage and make sure. You always have the opportunity, if you've got that, to get additional insurance and go directly as a professional and have your own insurance. And there are very good companies with that. You can reach out to the NATA website and be referred by the preferred providers from the NATA. You can actually Google and look on your search engines and look for professional liability insurance providers and to be able to get that. So, but the important thing with any of your professional liability insurance is look and see what they cover. Make sure you're telling them what you're doing, and if you are providing rehab and you're billing, et cetera, make sure that they're aware of that, because if you just say, well, I'm an athletic trainer, and as far as covering the type of activities that they may have written down as an athletic trainer, you need to understand that. As you all know, anybody that's an athletic trainer that may be hearing this is we're always educating, and that can be true with the insurance company as to what we're doing. What else do we need to know? Well, we need to know about, if we're billing, the billing form or system that's going to utilize. So that is probably an electronic medical record, hopefully. I'm hoping that if you are billing that you're not looking at doing paper pencil and to do that. So what type of billing format? What type of electronic medical record are you utilizing? Is that electronic medical record robust enough to be able to do your billing? And again, there are literally hundreds of different EMRs that are out there. There are some EMRs that are very sports medicine specific. Many of them do have the capability of having the coding and that sort of thing, and having the information to be able to be transferred to be able to do the billing, but need to look into that and understand that. ICD-10 codes, we will talk more about ICD-10 codes a little bit later, and CPT codes. So those are things that you really do need to understand, because that's, the coding is how we're going to go about the third-party reimbursement. So we'll talk more specifically about that. We've said a little bit about the MPI, but this question and what you need to determine as you're developing your plans and thinking through about billing is under whose provider number, in other words, under whose professional liability process are you going to be billing? Are you going to bill autonomously as an athletic trainer? In other words, are you going to bill as a professional that's performing their scope of practice and are independently reporting that professional service? So billing autonomously, just as an MD or a PT or an OT may be billing, and you're billing that under your professional NPI number. Are you going to do that, or are you going to bill as a clinical staff member under another medical professional's NPI? Usually that's going to be the physician that you're doing that, but there are other medical professionals, depending on the state and the State Practice Act that you have. Are you going to bill under their provider number? You need to understand those because the rules and regulations on supervision and what you're doing and how you bill differs between billing autonomously and billing, as a clinical staff member. So you need to understand that, determine that. That would be for an entirely another presentation to discuss, but it's something that you really have to root out and understand. What's your fee schedule and your pricing strategy? How are you setting that up? How are you setting your fees? To move forward with that. There are, probably 3 different methodologies that come to mind in setting your fees. The most common that I'm aware of and that my company tends to utilize would be utilizing the Medicare Physician Fee Schedule. The Medicare Physician Fee Schedule, they do a lot of the work and they rate all of the codes, and they come out with a Medicare fee schedule of what Medicare would pay for every one of the CPT codes that's listed in the CPT code book. Now, just because it's the Medicare fee schedule doesn't mean that's the amount that you'll utilize. What many companies will do, many practices will take a percentage of the physician fee schedule. It may be twice the amount, it may be 1.5 times the amount, or some percentage of Medicare, but it's never pricing it below the Medicare physician fee schedule. So that's one aspect. The other is you can do a market analysis to really analyze in your particular geographic area what are the market rates. That's going to be a lot harder to find out. There are some systems that you can reach out and be able to do that, but you can do that. And then finally, you can actually do your own work analysis and determine the resources and the costs that you have and the amount of time that you're utilizing and be able to set your pricing strategy at that. Both the last two are time consuming and difficult. The physician fee schedule is really what most insurance companies actually set their pricing strategy on, some percentage of that. So that is probably the best way to go with that. You also need to determine, depending on what practice that you're in and how you're moving forward with this, obviously if you're listening to this, you're thinking about third-party reimbursement, but is that going to be your entire practice? Is everything that you're doing going to be insurance billed, or will there be cash payment? Or are you in some type of business that you may be doing some billing, you may be doing some cash payment, and you may be doing some contractual arrangements like outreach programs to that you're actually contracting for a set amount to provide services? Or is it a combination of all of those things? Not wanting to get too in depth on the fee schedule, but the recommendation that the Clark Group has is that setting your fee-for-service fee schedule, that you should have one master fee schedule. So you have one fee schedule, you don't have multiple fee schedules for a lot of different situations. You have one master fee schedule in which, yes, you're able to do discounts off of that fee schedule for different situations. The most easy would be you have a standard master fee schedule that you bill everybody with no matter what. and then you have cash pay patients that you're going to give a 50% cash discount, for example. And so you actually, on your invoice, would bill the cash patient the full amount, the master fee schedule, and then show on the invoice that you have given them a 50% discount because they're paying cash. And you do that for all of your cash pay patients. You can't pick and choose. It needs to be, if it's, they call it by class of patients. So in this case, the class would be all cash pay patients would all receive a 50% discount. And it needs to be consistent. So I'm going to stop there. We could, it's something that I could probably talk an hour on, setting fee schedules, and to do that, but you really need to investigate, understand how you're going to set your fee schedule up, and what policies and procedures that you do have with this to make sure that you're staying within appropriate guidelines. You do want to understand, within your state, what is the environment? What's the legislature, the insurance commission, workers' comp board, the insurance companies within your state? Do they recognize athletic trainers as qualified healthcare professionals that they reimburse? And this goes along with the research you're going to find out from your state association on what's going on insurance-wise. I will say that even though you might have an insurance commission or workers' comp that do not recognize athletic trainers, that does not mean that you cannot bill and actually be reimbursed. I've worked with many clients that we've had that situation, and the state work comp board was very adamant that they did not recognize athletic trainers, and yet I would have 2, 3, 4 examples of different practices that had athletic trainers that have had approvals from the workers' comp board and were getting reimbursed. So just because there's an official response does not necessarily mean that it is a definitive no when it comes into practice. It's not illegal. There's nothing with that. And from the business aspect, we find that no, actually the athletic trainer is being recognized. So those are the nuances that you need to look at and find out. Do the insurance companies within your state, and maybe, and it won't be all entire, but do they actually contract with athletic trainers to be preferred providers for their company? And it's not just athletic trainers. Some insurance companies just do not contract with allied health professionals. So they don't contract or credential PTs, OTs, speech either. So you need to understand that as part of your research in going through this. So we kind of talked about, those are some of the basics. Certainly I don't pretend that that is all inclusive, but those are all things that need to be understood and researched as you're developing your information, your business plan, and your strategy for third-party billing. So what are the benefits of third-party billing? Obviously, if you're looking at this, you've thought about this. And here are some that are not necessarily in order of priority. The first one I probably would rate as the highest priority, and that is recognizing athletic trainers as qualified healthcare professionals. By being recognized by insurance companies, and if we were recognized, say, by CMS, which we're not, which would be federal across the board, or by major insurance companies of Blue Cross Blue Shield or United Healthcare, et cetera, if we had that recognition across the nation, that would raise the bar for all athletic trainers, no matter what the employment, whether we were working secondary school, collegiate, military, performing arts, occupational health, safety, public safety, et cetera. That would raise the bar with that in that recognition. So that's important professionally. It does even the playing field with other allied healthcare professionals when we're recognized, because they're being paid. That pay has helped. We know that their base pay is significantly higher than what athletic trainers are. So that would start pushing us up, closer to that reimbursement level. Obviously, a new revenue stream for athletic trainers. This is new territory for athletic trainers, and so that it would be definitely a new revenue stream for athletic trainers. If we're working in the physician practice aspect or health system, or a physical therapy or rehabilitation standalone practice, if we as an athletic trainer are bringing revenue, if we are a revenue generator, then that's a significant positive. And that obviously is a lot of the complaints that the many athletic trainers have, is that we are a cost, not a revenue generator, and that's why we don't get paid very well quite often, and our jobs may be the first ones to get cut when things get tough. Accessibility to different segments of population. So as that opens up, that may be as much more with the State Practice Act and what you're able to do than actually third-party reimbursement. But certainly when we bring money into the situation, the whole industrial, occupational health, public safety arena, performing arts, those are all definitely very positive areas to get into, and affects that. And increased visibility, and we hope referrals are all positives with that. What are some negatives or drawbacks? So we kind of talked about the positives when we think about that, but what are the drawbacks of third-party reimbursement or billing? Well, there is increased administration, and there's no way of getting around that administration. Documentation is going to go up. There is a very, very small percentage of athletic trainers that I would consider that are doing the level of documentation that meet insurance company standards if you're billing for that. There just has to be significant documentation standards that are met, all the way from the assessment, the full SOAP format, but not only within SOAP, it's documenting amount of time that we're actually doing procedures with the client and those kind of things. So certainly increased documentation. Pre-authorizations, we go with that. And it may be pre-authorization. We often think when we think pre-authorization, we're going to ask the insurance company, do they recognize athletic trainers and will they pay for that? That is one form of pre-authorization, although I don't consider that a good approach to take. Part of the pre-authorization is to find out, does the person that we're treating who says that they have insurance, do they actually have insurance, and what does their insurance benefit package say? Do they have physical medicine rehab benefits? How many sessions do they have per diagnosis or per year? And that's that type of pre-authorization. That takes time, time that we as athletic trainers don't necessarily have. So we're really talking about paperwork overload. I mean, it's just all very time-consuming in the administration. The increased regulations or people looking over our shoulder, whether that's the insurance policies, it could be state law, could be state insurance issues. I have listed here your copays, deductibles, coinsurance. So we all know, for the most part, have insurance, and I would say all of us have copays and deductibles, and we may have some type of coinsurance. There are stipulations within our policies that indicate that we're supposed to be paying copays or deductibles and how we're supposed to do it, and the people that treat us and how they're supposed to be treating that. Well, we are now the providers on the standpoint. So these are regulations. These are contracts. There is legal ramification to these. We don't have that when we are treating our student athletes in a secondary school setting, without billing, or collegiate setting, or et cetera. So definitely increased scrutiny, if you will, on this. Increased infrastructure. And as I put on here, that means cost. So we've already kind of talked about all the increased administration, but if you think about billing, which is you're adding a total additional layer to everything that you're doing. You have to do all the documentation, the coding. Coding has to be properly. It has to be sent out to the insurance companies, and done that. We're going to get responses back from the insurance companies, not always getting paid, as we're going to talk about at the end of this. And so it takes someone to develop that. It takes a system, electronic system, to be able to run that. All of that costs money. So it can be significantly costly to bill for that. We also know the reimbursement rates continue to decrease. They're not going to get better. They're just going to keep getting squeezed. So there are many medical groups, not athletic trainers, so physical therapy practices, physician practices, etc. They do whatever they can to get out of the insurance game. So they're looking, at doing concierge type of services for cash. They found that is much more beneficial because of many of the things we've talked about above with administration regulations, decreased reimbursement rates, and et cetera, to be able to go a cash methodology rather than insurance. So we have to recognize that is the the cost benefit ratio really worthwhile to get into third-party reimbursement with all we're going to have to do and with what we're going to get reimbursed for it, worth all the hassle. And then lastly, timeliness of payment. So we've done all the above correctly, and we've billed correctly, and it kicked it out. The insurance companies do not turn around and send you a check right away. Very commonly, it's 60 to 90 days of turnaround to get paid for a service that you provide today. Well, during the 60 to 90 days, you've had to pay for services. You've had to pay to keep the lights on and your buildings. If you've got any staff, et cetera, you've paid and are paying for that now, but you're not getting your revenue until 2 or 3 months later. So certainly affects cash flow, and that has to be taken into consideration. So definitely drawbacks. I don't want to be a Debbie Downer here, but it is reality, and it's something that people need to understand if you're considering third-party reimbursement, all the various things that you're going to get into. So I mentioned before in our intro talking about different payer provider types. So often when I'm talking to athletic training groups, and I'm talking about third-party payers, it's all kind of lumped together as a third-party payer. Well, there are many different types, and all of these types of different payers all have different policies, different strategies to be able to work with them, and et cetera. And so I've listed some out. Federal, we know that Medicare or TRICARE. TRICARE is a military insurance or for military personnel, their families, and et cetera. Medicare, we know, does not recognize athletic trainers as qualified healthcare professionals to be reimbursed. So federal does not recognize us, their payer. State Medicaid. Medicaid is a state-run but a federally subsidized or federally supported program. The difference here is that the state has the capability of recognizing athletic trainers as providers and paying us. Even though it's federal money, they could actually do that. That's information that's come out of the third-party reimbursement initiative and work that we've done there. To my knowledge at this point in time, there are no states that Medicaid that has jumped up and are reimbursing athletic trainers, but there are discussions with different states in looking at that. The group accident health insurance, the commercials, that's what I call the big five, the Blue Cross Blue Shield, United Healthcare, Humana, Cigna, Aetna, with that, and then you've got literally hundreds of other insurance companies You've got work comp companies that deal just with work comp insurance. There are some companies that specialize in that, and then probably all of the big five have got different divisions that have work comp divisions they do with that. You've got third-party administrators, or TPAs. These are companies that are the administrators. So you have large companies or colleges or hospitals or et cetera that are large enough that they can pay their own health care. They generate enough revenue that they can fund their own revenue costs. They just need someone to administrate that program for them. The third-party administrators administrate that. Now, often the third-party administrators could be, there's a division of Anthem Blue Cross Blue Shield or Blue Cross Blue Shield that is a TPA, that they administrate that. But then there are some TPAs that that's all they do, and they are not an insurance company as well. So understand the difference between the commercial insurance and buying the insurance, and then the company that the company's actually paying it and paying an administrator to administrate it, but they're paying their own bills. And then finally, personal injury or PIP. So your car insurance is any type of accidents that go on. So you've got your State Farmers, Prudentials, Indiana Farmers, et cetera, that are doing that. And you think about that, there's definitely a lot of rehabilitation that goes into some of the auto accidents and personal injury. And I would say that a lot of athletic trainers have not gone into, working with that clientele. So it's important to understand all of these because they all are different. They all have different policies. They have different strategies in which to be able to work with. And so you have to understand that to be able to move forward with them. I just want to spend a little bit of time with contracting and credentialing. The reason I put this in my talks is that to be considered a preferred provider with an insurance company, with those commercial insurance companies or maybe even work comp, we need to have a contract with them. And that contract is just an agreement that the insurance company is recognizing us and they're contracting with us and putting us on their panel or their board, and they recognize us as a preferred provider, okay? And we've filled out all the information, we've met the qualifications, and there's a contract. And that contract, we're saying we're going to follow certain rules and regulations, and they're telling us, well, this is what we're going to pay you for that, and et cetera. That's a contract. Credential is a step above that. It's a contract plus they're checking out the liability issues. Have you had any legal suits against you, any malpractice issues, et cetera. And so the credential that insurance companies do, the credentialing, is for their clients. They want to tell their clients that we have credentialed and checked out our preferred providers and credentialed them and done an additional layer. I say all that to say that because we are a fairly small group currently as athletic trainers, that insurance companies, because they have to spend more money in doing the credentialing process, insurance companies very well may just say, we're going to, if they will contract with you, we're just going to contract, we're not going to credential. The reason I put this in my talks is I actually had a client tell me one time, well, the insurance company was only going to contract with me, not going to credential, and they weren't going to do it. And I said, no, that's good for you. That doesn't change anything for you. You're going to get paid. The credential is for their clients. So understand that. And this is just really kind of explaining, a little bit more the contract for credentialing and what I really have already discussed. There is one additional credentialing aspect that we as athletic trainers will deal with. Health systems or surgery centers quite often credential the medical professionals. If you're going to be in an OR, you're going to go through a credentialing process to be approved to be able to go into that. So if you're an athletic trainer that's working in a physician practice and you're going in the OR with your physician, you're probably going to be credentialed. There are some health systems that credential all of their health care or their allied health professionals. Then there are some health systems that don't do that at all. So just know that that credentialing is different than the insurance credentialing. CAQH. I'm hoping that those are initials that you've heard. A lot of people don't know what it is. Council for Affordable Quality Health Care. This is important in the contracting credentialing phase because this is where almost 100% of the insurance companies gain their information. They pull their information electronically from CAQH. It is a data resourcing company or a data source where this information is stored, and they pull from that. Historically, before 2002, all of this was on paper, and there was no common data source for this. And so if you had a physician practice that was trying to contract with 20 different insurance companies, there was 20 different 35-page applications being filled and sent out there. So this is as this explains, simplifies, expedites the data collection. It's supported by all the major insurance and provider associations. And this just kind of lists, some of the people just to show that, everybody is involved in it. Why it's important for us and why, I include this in there is that until 2015, athletic trainers were not listed as a qualified healthcare professional or a medical professional in their drop-down. There was no way for athletic trainers to be included in this electronic data collection process. What that meant was we had to do paper. People didn't like paper, so it was another roadblock for athletic trainers to get into the contracting credentialing. Since that time, we are now on this, so you can see the link there to be able to go do that. So go out and research this. There's also information on the NATA website that you can go out and be able to find about CAQH. This is a big deal. It was a big deal in 2015 for us to get on, included in CAQH. What I want you to recognize is just because we as athletic trainers can have our information stored on CAQH does not mean or guarantee that we will be accepted or recognized by the insurance companies that pull the data. Okay? This is just a data holding source. Does not mean that we're going to be recognized. So please understand that. NPI, again, this is something I'm really hoping that that anyone that is reading this, that this is the skip section and that you really don't need to know about. National Provider Identifier, it's something that was created to have one identifying number for you as a professional that you would have for your entire professional life. You have one number and it's utilized. It was created by HIPAA that we'll kind of explain. But here's some of the definitions of this, and I'll explain why these are important. This is defining, who's a healthcare provider, and this is defined by the Department of Health and Human Services, and it's a HIPAA administrative simplification document. Okay, so the key here that I've highlighted, any other person or organization who furnishes, bills, or is paid for health care in the normal course of business. That's us. Athletic trainers would do that. Part of HIPAA, as this lays out, it's a unique identifier for covered healthcare providers. This is the definition that's laid out as part of this. Healthcare providers must use the NPI for administrative and financial transactions. underline administrative. So even though if you're not billing or going through the financial aspects, administrative, your electronic sending information back and forth. You're an athlete trainer working in a health system trying to get information back and forth with your secondary school or collegiate setting, and you're administratively going back and forth. MPI is important, you know, and it is HIPAA directed. So MPI is important, and as I stated on here, you know, it is a professional necessity in this age of electronic medical records and billing. And I liken it to the NPI for us professionally is just as important as our Social Security number. And we all know there's no one that is listening to this presentation or taking this presentation that does not have a Social Security number. You have to have it to be able to do anything, open up accounts, go to college, open bank accounts, et cetera, et cetera, et cetera. In MPI, that's where we're at, and it's going to be, and it is a professional necessity from a healthcare standpoint. So if you don't have it, please get it. Very important. This is the AT taxonomy code that you would utilize in signing up for your MPI, so just to provide that for you. I want to talk to you briefly about ICD codes. They are diagnostic codes. These are used by the practitioners that can diagnose. Now, the distinction I want everyone to get, if you're an athlete trainer, it is not within our scope of practice to diagnose. We can make recommendations to the provider. We're on their team. We're doing that. But the only person that can really legally provide the ICD, and it's ICD-10 now, the diagnosis codes, is the referring provider. It's within their scope of practice to diagnose. It is not ours. So just a little information here. We went from 9 to 10 back in 2015, became much more specific, you know, quadrupled the amount of codes, and it really was more on specificity with that. So it's the ICD-10 that we just talked about, that is diagnostic codes. Those are provided to us by the professionals we're working with, usually physicians, could be chiropractors, dentists, etc. But they're making the diagnosis, they're telling that to us. The CPT codes are procedural codes. These are the treatment, or what we do for procedures or treatments of the diagnosis. They're owned and operated by the American Medical Society, the American Medical CPT Code Committee develops these. They meet 3 times a year, but they do a tremendous amount of work throughout the year. Anybody that's looked at the CPT code book and how thick that is, this group completely oversees that and wordsmiths every word that's in that. They add, they delete, they change as healthcare changes with it. So the CPT codes that most affect athlete trainers are the physical medicine rehab codes, which are the 9700 series codes. I've listed a few here, therapeutic exercise and muscular rehab, et cetera, manual therapy. There are many, many others, and that you can be able to find in the CPT code book, and you can find any up-to-date CPT code book with that. You can, if you want to go online, obviously you can get some stuff online. You could also get CPT codes most utilized by athlete trainers on the NATA website. The information here, and the reason that I put this on here and the importance really goes to the next slide. The point that's being made here, and it's defined within the CPT code book, is that CPT codes are not profession specific. So while often we are told as athletic trainers that's a PT code or that's an MD code, but most likely the 9700 series, that's a PT code. That's not correct. That's completely misunderstood. The AMA does not agree with that. They own it. They know that those are descriptors of procedures and treatment. Any medical professional operating within their scope of practice that is doing what is described in that CPT code can utilize that CPT code to code with. So you as an athletic trainer working within your scope of practice can utilize that code. You know, if you're meeting the descriptor, and that's all a CPT code is a descriptor. So you can get a full listing of the CPT codes, up-to-date manual on the NATA website, or certainly electronically. Billing forms are something that we need to understand. It's something that quite often we as athletic trainers don't get into, and hopefully you've got a good billing person that you would be working with, or a billing department. But just as a point of understanding for you, CMS 1500 is the format that is going to be utilized by physicians, by private practice groups, PT, rehab groups, etc., AT groups if you're doing that. It's also utilized for billing Medicare and Medicaid. It's that format. A UB04 is utilized by hospitals. It's a billing format that was put together by the National Uniform Billing Committee. And they utilize that format. The difference in those two is that the 1500, you're going to utilize the NPI number is going to be utilized in that. In the UB04, they utilize revenue codes. And you can see 940 or 951, one's therapeutic services, the other one's athletic training. Look at the definitions of that, but that really becomes a business decision made by your practice as to which revenue code you would be utilizing there. Other revenue codes, the 837P is actually the standard format for electronic billing, so that's really what most billing is going out in. And NPI numbers are utilizing that, so it's kind of formatting the 1500. And then in personal injury and work comp, some of them will just use an invoice. So they don't even utilize, you know, the standard billing forms. And I've just kind of listed, you know, all the information, patient name, referring, pre-authorization, you know, date of injury, ICD-10 codes, and then the clinician or the billing office information needs to be included in the invoice. If you want to be paid, you need to get all the demographic data in that invoice to get paid appropriately. But again, PIP and work comp may just be a straight invoice situation. So finally, we've done everything right. We've researched. We're working within our scope of practice. You know, we've got the script from the doc. It's for an athletic trainer. We have, you know, got the ICD-10. We've billed properly on the right format. We've billed appropriately with the CPT codes and et cetera. And then we're going to get back from the insurance company, after we've billed all this appropriately, we're going to get what's called an EOB, or an explanation of benefits. And we're going to get some denials. Everybody gets denials, so that's not unusual. What I've listed here are some of the common reasons for insurance denials, and this is for not just for athletic training. The last one is, but for anybody. So they needed pre-authorization. That's in their policy. They've got to have it. Or the documentation did not match up properly. The diagnosis, the ICD-10, compared to the CPT codes in their system, it didn't match up. You know, you can't utilize and treat that diagnosis with those procedure codes. They don't match up, so they kicked it out. The referral, they don't have a referral from the referring physician, so it's either not signed or they didn't find an actual referral in the EMR with that. The patient's not in the insurance company's network, or members already had services for the same diagnosis someplace else. Their benefits are all utilized up, and so it's denied. Or, finally, the AT is just not recognized, so you've put your NPI in there and done it, and just not covered. So the good part about the EOB is they're going to give you a reason, an explanation why you didn't get paid. So what do you do? Well, a lot of different things. You're going to work the account, and whatever the EOB comes back and says that you didn't have, you're going to respond to. And some of those responses, you may be able to talk sometimes. And again, hopefully it's not you as the athletic trainer. It's going to be your billing. You're going to have billing staff that's going to do this because you don't have the time, most likely, to handle this. But some of the discussions, I want to say, I'll say arguments, but I don't mean it to be an argument, is that back to them is, well, several other insurance companies are paying for this, or work comp is recognizing our services. Why aren't you? And then be able to give them documentation to that. And that's where the third-party reimbursement initiative information can come in handy. Explain that denial of AT services may be a disservice to your patient, that we have great outcomes and we're doing this. This is a tremendous support to the employers, patients, for this service. So you're trying to explain to them what's going on. Have the patients reach out to the insurance company. They obviously are the insurance company's client. Be professional, courteous. Okay, don't get mad, and with that, accept no if it's obvious that no is where you're at, and make sure that you documented, all the information that you had. Additional things to go through, because you've taken no from that initial, but you're going to move up the ladder as much as you can. Demonstrate there's no concern for the quality care given by athletic trainers. Athletic trainers do not drive up the cost of the services. So we're providing these services. It would maybe have been done by a PT, an AT did it. Our services are not going to be more expensive. That we align our patients with proper professionals. So we're not going to keep treating this patient. If they need to be seen by somebody else, we're going to make sure and get them referred to that. Have the referring physician send a letter, and or one of the things is you moved up the ladder. Try to be able to meet with the medical director of the insurance company to discuss who we are, athletic trainers, what your license is, our educational background, and be able to work through those issues. Because there's a very good chance that they do not have any idea who we are. So that's our presentation for you. That's Billing 101. This has been an overview of what we've got. Listed here are all the different resources. These are all found on the MATA member website that you can go out to and add information. All of the information I provided is going to be supported by this, and then this will give you some additional background here as you may look and go from there. So take a look at these resources and go from there. I leave you with this quote: leadership is a potent combination of strategy and character. But if you must be without one, be without strategy. I encourage all athletic trainers are going through this to be the highest level of professional that you can be. We're representing our profession. Third-party reimbursement is new on the playing field for athletic trainers and to insurance companies, and they don't know who we are. We want to present ourselves as high-character people, high-integrity people, and that we are doing and seeking to do third-party reimbursement at the highest quality and highest benefit. So let's represent the profession this way. Thank you for listening. Thank you for the opportunity of presenting to you. Y'all have a great day, and look forward to helping you, through third party, or not third party, helping you from Clark Group Associates. So this presentation really is showing the money. I'll work on that. Thanks for your attention, and I hope I have the opportunity of meeting you personally at some point. Thanks.